With hospitals across the country facing a crush of patients with COVID-19, both routine medical visits and surgeries that would have been urgent at any other time are now taking a back seat as many local and state health authorities put a halt to non-emergency procedures. And now some doctors fear that some of those delayed medical treatments could have their own devastating toll. ABC's Will Carr has this story.
Behind the doctors and the nurses on the front lines, another medical crisis is about to explode.
He did have several blood clots.
It's a ticking time bomb. You may end up seeing a lot more, people who may suffer. Either they may die or they may end up having morbidity. They may end up getting issues which should have been addressed and handled right now, and we are pushing them.
So many hospital resources concentrating on the COVID-19 crisis, many local health departments have ordered a ban on non-essential surgeries, pushing serious medical procedures back, some indefinitely. You're concerned that more people could die by not getting the surgeries they need right now than from the coronavirus.
The longer we go now, no question about it. No question about this. In the San Francisco area, no question about this.
Medicines we give you, stop it.
Dr. Philip Theodosopoulos is treating Rosemary Pathy McKinney at UCSF in the Bay Area. Rosemary has 2 brain tumors.
It's just this constant head pressure, so it's always on my mind. It's just the fear of the unknown.
They were supposed to operate in March to remove one tumor and find out if both are cancerous. But the day before surgery, with her head shaved, because of that city order, Rosemary and her husband Rick were told they have to wait.
We're gonna cancel all the elective surgeries. And I said, well, she's having brain surgery. This is not elective. Nobody elects to have brain surgery, right? This is not a facelift.
In hospitals across the country, patients with critical life and death issues are being pushed to the top of the list for surgeries. Dr. Anu Shah, New Jersey, worries about the other surgeries being delayed.
In that gray zone are urgent procedures which should be done within like 1 or 2 weeks, and those are not being done.
We usually do at Parnassus, which is our main hospital, we do about 70 operations a day. That's altogether all services. And we're down to about 8. 8.
In Washington State, Liz Rayburn suffers from tremors. She's undergoing deep brain stimulation, which requires 2 surgeries. In the middle of her first, while she was awake on the operating table, she says she found out the plan for the second changed.
My neurosurgeon, who's standing right behind me, said, Liz, I have some good news and I have some bad news. And I said, hit it. He said, the good news is that we're done and it has gone very well. The bad news is that your second surgery has just been indefinitely postponed.
Adding to the stress, patients like Rosemary, who's thankful to have had a successful brain surgery Monday, can't have their families with them before, during, or after their procedures.
I will hold her hand when she goes to sleep, and I will be there for her when she wakes up, and all of our folks. But that's tough. That's really tough.
Tough indeed. And Will Carr joins us now. Will, how are these patients that you spoke with coping with these delayed procedures? And how are the doctors and hospitals deciding who gets to the front of the line?
Well, Lindsay, it's a healthy balancing act. They're trying to weigh those critical surgeries that people need versus keeping all the facilities, the hospitals across the country safe. As for the patients we've been talking to, they're all taking it in stride. You heard from Liz with the trimmer. She has to have a couple devices installed during her surgeries, and she's keeping a healthy sense of humor. She told me that she's looking forward to being a functional cyborg, which really cracked me up. It also made her husband laugh, who was also her photographer because of our technical difficulties. So she was definitely keeping a good sense of humor.
And as hospitals try to get through the immediate crisis, what are doctors saying some of the long-term consequences of these delayed surgeries could be?
One doctor tells me that right now they have a backlog of surgeries with their caseload of 6 months. He says that's right now. His biggest concern is what that backlog will turn into as this crisis continues to move forward. Another doctor tells me his biggest concern is economic. All the hospitals across the country plan in their budgets these surgeries, the money that comes from these surgeries. He's worried that on the back end of this crisis, the very men and women who are on the front lines right now could see pay cuts or even layoffs. Lindsay.
All right, Will Carr, thanks to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.